Have you ever wondered what goes into a buttock enlargement surgery? In the realm of plastic surgery, buttock enlargement or gluteoplasty has seen a remarkable surge in popularity. It's a testament to the ever-evolving standards of beauty and body image as well as the medical advancements that make such procedures possible. But why do people opt for this procedure? Well, the reasons are as varied as the individuals themselves. For some, it's about enhancing their aesthetic appeal, perhaps seeking to balance out their proportions or simply striving for a more voluptuous silhouette. Others may choose gluteoplasty for reconstructive purposes, such as after significant weight loss or injury. Beyond the aesthetic and reconstructive motivations, it's worth noting that this procedure also carries a profound impact on one's self-esteem and body confidence. It's not just about changing a physical appearance, but also about transforming how one feels about themselves. Now let's delve into the fascinating process of this unique surgical procedure. Before the actual surgery, thorough preparation is key. Step 1. The journey to a more rounded derriere begins with an essential consultation with your plastic surgeon. This isn't just a friendly chat, but a chance to evaluate your overall health and suitability for the procedure. It's during this period that any pre-existing medical conditions and lifestyle factors will be considered to ensure your body can safely handle the surgery. Next, you'll receive pre-operative instructions. Think of these as your roadmap to a successful procedure. You may need to adjust your diet and medication regimen. This could mean avoiding certain foods or drugs that can interfere with healing or anesthesia. And finally, it's important to manage expectations. While buttock enlargement can certainly enhance your silhouette, it's not a magic wand. The results, although significant, will still be confined to the realities of your body structure and individual healing process. With all things in order, we can proceed to the surgical procedure itself. The surgical procedure is a meticulous process that requires precision and expertise. It all begins with the administration of anesthesia. This can either be intravenous sedation or general anesthesia, depending on your doctor's recommendation and your personal health status. Next comes the incision. Depending on the specifics of the procedure, the surgeon might make an incision either within the natural buttock crease, or at the corner of the buttock and thigh, or down the center of the sacrum. This is done strategically to minimize visible scarring. Now, if you're undergoing a buttock implant procedure, the surgeon will insert a soft-shaped silicone implant into each buttock through these incisions. The implants are placed either within or above the gluteal muscle on each side. Alternatively, if you're having a Brazilian butt lift, which involves fat grafting, the process is slightly different. The surgeon will firstly perform liposuction to remove fat from other parts of your body, typically the abdomen, hips, back, or thighs. This fat is then processed and purified before being re-injected strategically into different areas of the buttocks to increase volume and improve shape. Regardless of the method used, the final step in the procedure is suturing the incisions. The surgeon will use sutures, skin adhesive, or surgical tape to close up the incisions. This marks the end of the actual surgical procedure, which typically takes somewhere between 2 to 3 hours. It's important to remember that every surgical procedure carries some level of risk, and the specific risks associated with buttock augmentation can be discussed in detail with your surgeon. However, when performed by a board-certified plastic surgeon with specialized training and significant experience, the rate of complications is typically quite low. Once the procedure is complete, the recovery phase begins. This is a crucial part of the journey towards achieving that desired shape and contour. Recovery is an essential part of the buttock enlargement process. Once the surgery is complete, managing discomfort is the first step in the recovery phase. Pain medication will be prescribed by the surgeon to help manage any post-operative discomfort. Next comes the care of the surgical area. It's crucial to maintain hygiene and cleanliness to prevent any infection. The dressing and bandages must be changed as per the surgeon's instructions. The timeline for returning to normal activities varies from person to person. Generally, patients can get back to light activities within a few weeks, while strenuous activities may take several weeks or even a few months. The surgeon's instructions are not mere suggestions. They ensure optimal results and a smooth recovery. Following them closely is key. To recap, buttock enlargement surgery involves careful preparation, a detailed surgical process, and a dedicated recovery period. Remember, it's important to have a thorough discussion with your healthcare provider before deciding on any surgical procedure.